Back pain caused by overexertion at work is one of the biggest workplace injuries on record. Nearly 65 million Americans report a recent instance of back pain. 16 million Americans experience chronic back pain. That's 8% of all adults. Healthcare and indirect costs of back pain in America amount to $12 billion each year, and 83 million days of work are lost to the U.S. economy directly due to back pain. Most of this back pain is related to gradual injuries sustained in the workplace. Lifting heavy things, twisting poorly while holding weights, and incorrect bending are big culprits. We met up with Eric Eitel from German Bionic at VivaTech 2024 in Paris, and they have a solution to industry-wide workplace back pain.
We're German Bionic. We build human augmentation technology here at VivaTech, which is actually one of our favorite spots in the past years. We show some of our latest developments. So, in general, as you can see, we have exoskeletons that we built. These are robotic exoskeletons. That means they are software controlled, and they have integrated motors on the hips. What you see here is the Apogee Plus exoskeletons. Actually, exoskeleton that was developed to support nurses in the healthcare sector, so lifting patients.
To help people do things easily that would otherwise be beyond them or cause them pain. In the modern workforce, they've mostly been deployed in roles with lots of heavy lifting, but the number of roles that include repetitive heavy lifting is expanding.
During the pandemic, we had a lot of inquiries from people working in the healthcare system, because you basically had this big conversation about critical infrastructures and that they need to be supported. People in the healthcare field didn't feel very much supported during that time. So back then we started developing an exoskeleton that was specifically designed to meet the needs of people working in the healthcare sector who do nursing jobs. And we basically developed this Apogee Plus here together with a healthcare institution in Berlin, Charité, which is like the biggest hospital and healthcare institution in Germany. And they have like this fantastic nursing lab. So we had all the chances to really figure out things, finding out the needs in the field. And it was really helpful. Like in the end now we have this healthcare exoskeleton in use in hospitals, and we get the first results, and it's really promising. And so overall feedback is, if you ever lifted, for instance, your old mom or whoever, out of a wheelchair, for instance, I mean, it's really a heavy burden on your back, and if you have to do this all the time, day in, day out for years, I mean, you're definitely gonna hurt your back at some point.
Making wearable exoskeletons a must-have depends on making them easy to use. The German Bionic harness is a simple process and easily personalized to the wearer. That means organizations only need to buy a standard product. It also means they quickly become intuitive for users, so the learning curve is shallow.
We started developing it for the logistics and material handling sphere. So this is definitely, at the moment, the most important market for us. What we've seen is a lot of special issue workplace situations. For instance, baggage handling at airports is a fantastic example. I mean, everybody knows you see these people throwing these 23-kilogram suitcases. If you do that all day long, you're wrecked.
Work-related back pain is responsible for so many lost days of productivity. Deploying wearable exoskeletons has been proved to reduce pain. That means it also reduces lost productivity. Who knows how long it will be before wearable exoskeletons are the norm? Remember to hit the subscribe button and ring that bell to stay updated with our latest content. And while you're here, why not check out another one of our exciting videos? Thanks for watching, and see you in the next one.